Hi, Amita. I'm Karen. Hi, nice to meet you.
Nice to meet you.
Hi. So I'm here to talk to you a little bit about some things, okay?
Okay.
So you are 8 months pregnant, is that correct?
Yep, that's right.
Okay. So, you haven't got any prenatal care, have you yet?
No, not yet.
No, not yet. Okay. Well, as you know, pregnancy's only 9 months. So you're a little bit late, but that's okay. We can figure this out, okay? So that's what I'm going to talk to you a little bit about today.
Okay.
Okay. So, there are a lot of programs if you don't have a primary care doctor or if you don't have a gyno or anything like that, you can go to the local health department and they can teach you a lot about they can do some prenatal care with you, and it can be free or reduced depending on your income. So it's just based off of that. So when you do go to the health department, they'll do like a pelvic exam, a pap smear. They'll do some blood tests, like a urine test for protein and glucose. That'll just check your glucose level, your cholesterol levels, things like that, just to make sure that you're healthy and everything for the baby. They'll also do check your blood pressure, your weight, check for the baby's heartbeat, check all your vital signs. They'll check for the fundal height. That's how far up in the belly that the baby is. They'll check for the baby's position to make sure that it's in a good position for you to give birth. They can also do a non-stress test if you'd like to do that too.
Okay, and what kind of test? What do they do for that test?
That's just to monitor the heart rate of the baby. Yeah.
Oh, okay.
Yeah. So that's always a good test that we recommend.
Okay.
They can also recommend you or give you some prenatal vitamins. So those are always good to take, even though it's late. It's better than never.
Right.
Right. So you do work at a hotel, is that correct? Okay, so I know you're a maid there, and I know it can be probably you lift some things sometimes. Yeah. So it's recommended that you don't lift over 25 pounds when you're pregnant. So I know lifting mop buckets and things like that can be pretty heavy, I'm sure. So I just wanted to make you aware about that. Just to be careful about that. It could also hurt your back and things like that for sure. I'm sure you're already having back pains when you're pregnant. Yeah.
Every day,
Yeah, I'm sure. So after you give birth, first of all, they will recommend you to a good hospital for you to have your birth. And then afterwards, they'll recommend you to get a lot of rest, and because there's so much stress on your body going on. They'll want you to see a doctor 3 to 5 days after you give birth for a full checkup for the baby and for yourself. There's also programs such as WIC, which is Women, Infants, and Children. Yeah, that can be a good program to look into, and I can give you a pamphlet when we're done about that.
That'd be great.
So that's just for like nutrition education, stuff like that for you and the baby. There's also breastfeeding support if you're looking into that. And you can even get some free or really reduced price of infant formula. So there's a lot of good things for that. So I'm just going to give you this pamphlet here, so you can take a look at that, and that just shows about the WIC and how you can look into those types of things.
Okay, perfect.
So do you have any questions?
I can't think of anything right now.
Okay, well, we'll keep in touch, okay?
All right.
Thank
great.
you.
Thanks.